Good morning, respected chairpersons and ladies and gentlemen. I'll be speaking on this free paper on study of green laser in fungal corneal ulcer. I do not have any financial disclosure in this presentation, and it is purely an academic one. We know from earlier the corneal ulcer, which is a dry-looking corneal ulcer, and we usually do a scraping, and this scraping is showing a drug previously used, and what we published previously was the corneal ulcer stained with in vitro fluorescent stain. Now again, a situation where a corneal ulcer with evisceration with all these in vitro fluorescent stain showed fungus over the cornea, lens, and also in the vitreous cavity. This we published as a fluorescent dye as a novel cost-effective approach for staining raw specimen in ophthalmic pathology, which were confirmed by conventional staining such as Grocker's methanolyne silver staining. Now, the hypothesis of our thinking was that can we visualize microorganism without stain? There are various uses of laser in ophthalmology, you all know. Currently, microbiological staining in laboratory are the diagnostic modalities for detecting the microbes, especially the fungus. The objective of the study is to analyze the effect of laser in different fungus for their detection. Now, the laser, the pointer was used class 3 laser product, complies of 21 CFR with wavelength of 532 nanometer in laboratory setup was used and were seen on the objective of compound microscopy, Zeiss Exoscope 40, Germany. Necessary eye protection were taken in the laboratory setup. Raw specimen were studied, either a corneal button from the keratoplasty or even the scraping also studied. They were examined in the MRC camera attached to the microscope. These are all the fungal infection that we stain. And in vivo staining also, in spite of using a fluorescent strip, we use the fresh fluorescing solution to see the better way how they can demarcate this. Then we did a scraping, total 15 cases of mycotic corneal ulcer were taken, some were corneal button, and aspergillus was seen in 5, fusarium was in 4, carbuliria in 4, penicillium and 2 studied in raw specimen. The results were compared with conventional staining. Now you see in discussion, these are the stain. We know the conventional 10% or 20% KOH that can stain, but what we established is a fluorescent stain, which is a very rapid and cost-effective stain, and some of the corneal button GMS stain were done. And these are all the green laser which are being done to see the fungus enema. We know that label-free fluorescent is based on autofluorescent originated from endogenous fluoropores that can be found in the fungus, which is generated by basically by the chitin in the fungus. Nonlinear microscopy has a capacity of linking structural formation of the fungus. Spatial image can be acquired by point to point as in our study. Fungus can be seen in fluorescent microscopy by a chalcophore white stain, but this is very, very costly. It requires a very costly microscope, but our study was an alternative way done in conventional light microscope to detect the septic fungus. Limitation of the study was sample size was small, and further studies are required in that vein. Now we see this comparative stain. In fluorescent stain, you can see the conidia, phthalates, vesicle, the stipes, and in the laser photograph, you can well see the phthalates are so nicely picked up by the lasers. Again, a comparative, this is the carbuliria, and this is the laser how the carbuliria has picked up in laboratory setting. So in conclusion, stainless laser and its modification was effective in diagnosis of fungus in vitro in corneal ulcer. In future, the use of properties of light, I'm not telling the laser directly, can translate the innovation in real-time live patient fungus detection, particularly in the slit lamp examination. These are my selected reference, and I like to quote that process of innovation after a lot of basic experimental stage and scientific imagination. I acknowledge our corneal department, ocular pathology and microbiology department. Thank you for patient hearing.
That was a very innovative piece of work. I was only wondering that your work swings from one extreme to the other. On one hand, you said you used fluorescein staining, which is a cost-effective method without using any fungal stains. You saw on the light microscopy. On the other hand, you have used a stainless method using laser, which is a much more costlier technique. So what are you looking at? You're looking at a cost-effective method of doing things, or you're looking at a stain-free method of evaluating microorganism. I mean, which is your focus? Because you've said both in your paper.
Yeah, thing is that my published paper and the work on the fluorescein stain in vitro, and it is so effective. See, you see, KOE stain, it takes around 5 minutes to mount everything process. But you put a drop of fluorescein and immediately you can see the fungus. Now, next modification what I did was put a laser, green laser, and to see whether the fungus is visible by laser.
Now, I totally get what you did.
Yeah,
I followed that from your paper,
yeah.
but these are two different things is the way I understand. One deals with using an existing dye without involving another dye, and another one uses the same principle, but you know, that is a stainless method. So
Yeah.
it would have been more appreciable if you had dwelt a little more on, you know, the present work. But anyway, it
Yeah,
is a
this
very
process I am continuing.
Okay.
This process I am continuing.
It's a new and novel method. Very
Yeah,
nice.
this process I am continuing.